Let's go through how to do a belly massage with a ball. So I have a lacrosse ball. You can always use a tennis ball, which is a little bit softer. If that still feels a little bit too intense, throw a towel, like a tea towel over it. But also they make these balls on Amazon, kind of like a Pilates ball, but they're a lot smaller, sort of like the softball size. Those will have a lot more give. Maybe that'll be a little bit more comfortable for you if you're a little sensitive, but grab something like that. And what we're gonna do for this video is we're just gonna work on your belly. So usually we're doing this for people that have anterior or front hip pain, or we have a lot of tension, or maybe we have some scars, or even some bowel dysfunction like constipation. So we're gonna take that ball and we're gonna work it through our whole belly. So basically our go zone is gonna be below the rib cage and above these pelvic bones here. Anywhere within there is where we can work. We're not gonna put it directly on a bone. We can go down into our leg, into our quad, but that will just be a little bit more of a like leg hip mobilization than your pure belly. So what we're gonna do is we're gonna start on one side. We're gonna find that hip bone and we're gonna place this ball right on the inside of that hip bone. And then we're gonna lay on that ball. So we find that hip bone, ball goes right in it, inside of it, and we lay down. And as we lay down, we're gonna determine if we need to be a little bit flatter on the ball in order to find the tension. If it's too intense, we can be a little bit open, take some pressure off the ball. But we're gonna find a tender spot, and we might put it on some spot and it to not feel very tender, and then we have to roll and move to find where it might feel tender. And then I just hold it here, and I rest, and I hold for about a minute or two, seeing if that tension decreases as I hold the ball there. If this feels really direct and intense, you can always lay down and see if that feels better. And after about 30 seconds to a minute, it should start to release and feel a little bit better. Once it starts to feel like it's getting a little bit less tender, I want you to do some movement to it. So you can bend one leg up and down and just work there. You can bend it up and keep it there and rotate or windshield wiper your foot in and out and see if that feels good. Or you can be upright on your elbow and do a little bit of a rotation through your upper body. And what you're trying to do is find a spot or find a movement where that makes that tension even tighter or more tender, and you hold it there. And we just breathe and relax. Maybe we actively move back and forth with that movement. And after about 2 minutes, that spot should feel better. And once it feels better, you just take that ball and you move it, and you do the same thing. And you're just moving it to find tender spots. You're holding it there for about a minute or two, moving your leg or moving your upper body to help release the tension, and then you're moving on. We're not putting the ball and just rolling it all over nonstop for 15 minutes. So feel free to try that. You can do as many spots as you want, as long of a time that you have. Say you only have 5 minutes, say you have 20 minutes, and you can work wherever you want. I would limit it to about 15, maybe 20 minutes total, because this spot can feel really tender. But if you have a lot of tension here, it might be nice to kind of spend a little extra time there.